Hi, everyone. My name is Selena Belisle, and I am the founder at CE Institute. And I'm also one of the CE providers that teaches myofascial release, the CE classes that we try and get massage therapists to take because these classes provide an incredible benefit in learning how to work with fascia and how to release fascia and release restrictions so that you can make your massage therapy sessions more effective. So in a couple of minutes right now, we're going to try and teach massage therapists why they should learn myofascial techniques. First, I want to talk to you about a little bit of the difference of practicing massage and practicing myofascial release. When you're practicing massage therapy, one of the things that you're doing is increasing tissue metabolism. So every time you petrissage or effleurage an area, friction, what have you, you're evacuating the tissue of blood when you press on it. And when you release that pressure, there's a resurgence of blood to that area. When you're doing this, you're bringing in all new nutrients and oxygen. It's almost like removing some of the toxins in the tissue with that increased circulation as well. And that in itself can provide pain relief and other therapeutic benefits for the client. It makes them feel great. And of course, they want more. In myofascial release, it's a very avascular tissue. There's almost no blood supply to it. So this increased tissue metabolism does not help the fascia. In fascia, what happens is you have planes, and they're like these tubules of water with proteins, lots of collagen and elastin fiber, and it can become very dense, thick, and restricted. What we try and do in our myofascial release techniques, we're trying to stretch the fascia. And when you stretch the fascia, these thick tubules, they actually separate and they become thinner and thinner and thinner tubules. And as these tubules separate and become thinner, you actually increase range of motion, and this allows you to be able to penetrate deeper into the muscle. You're not having to work as hard because you've released some of the underlying fascia. And keep in mind, the deep fascia, it encases every single muscle, and then every single muscle fiber of each individual muscle is all encased in fascia. So we want to do these nice lengthening, stretching, separating techniques of the fascia so that we can get to the deeper muscle and provide massage therapy, trigger point therapy, and so forth to the deeper muscle to provide pain relief or whatever your client's goal is for the session. I want to share with you this study about fascia. We review several different studies in our myofascial courses at the school. But in this study, they said that the fascia, the thoracolumbar fascia, was 25% thicker in chronic low back pain clients than people who did not have chronic low back pain. So think about that for just 1 minute and look at the thoracolumbar fascia over here in this cadaver picture on the right-hand side. Your thoracolumbar fascia, it almost looks like that Christmas tree over the lumbar spine. Now imagine this thoracolumbar fascia being about 25% thicker than fascia that is thinner and less dense and more flexible. Now try palpating to the quadratus lumborum when you have 25% thicker fascia. Imagine how hard and difficult that is going to be able to push and penetrate to that deeper muscle when you have thicker fascia on top. That's why it's important to learn and practice myofascial techniques so that you can be more effective in your deep tissue techniques. Once you've separated the fascia that's encasing some of this muscle and on top of the muscle, even the superficial fascia, separating it, thinning the fascia, stretching it, increasing the amount of tendrils so that it's more pliable, that's going to be able to create a much more effective massage therapy session for you once you can get deeper into that skeletal muscle and create that false tissue metabolism with the ischemic compression back and forth. Get some really good blood circulation in there. Sometimes when the fascia is tight and restrictive, it's restricting circulation. And what happens when you don't have proper circulation to the tissues? It creates pain. So it's just this vicious cycle. And then what happens when you don't have proper circulation? You start adjusting your posture. So we hope that you, in this couple-minute lesson, have learned a little bit of why it would be important to learn the myofascial techniques to loosen the fascia around the muscles, so that when you're practicing your deeper tissue techniques, whether it be trigger point therapy or neuromuscular therapy or what have you, it might be a little bit easier for you, and it might provide a much better result for the client. So my name again is Selena Belisle. I'm one of the myofascial release instructors here at CE Institute, and we teach many different modalities here at the school. You can find all of our training at ceinstitute.com, and we hope to see you in one of our live classes. Until then, be safe.